Hello, it's Friday, June 17th, and must be time for another legislative update from your North Carolina Medical Society. This one's going to be a little lengthier because I need to give you some details about a couple of bills. So let me give you a preview of what I'm going to talk about. I'm going to talk about three specific bills. The first, I'm going to talk about the PA bill, or Senate Bill 345. I misstated something last week. I want to make a correction there. Secondly, I'm going to talk about the federal gun violence prevention bill that has been introduced by a coalition of Democrat and Republican senators. And then finally, we're going to go into some detail about House Bill 149, which is the Medicaid expansion bill put forward by the Senate that has all those other things attached to it. You've mainly heard about the SAVE Act. I want to make sure you have a full understanding of why we are opposed to House Bill 149. So let me go back to the beginning. Last week, I was explaining our support for Senate Bill 345. It's just the PA Modernization Act. And I misstated exactly why or how we would be working with our team partners, the PAs, going forward when and if this bill passes. If you are in a team-based setting, as newly defined in this bill, then you would be relieved from many of the administrative burdens that currently are under the direct supervision laws between a physician and a PA. If you are a PA working in an independent setting, then supervision by a partner physician is still required. So let me be clear about that. In a team-based setting, you're working as a team, you're regularly interacting with one another, you're giving your best as a group to the patient, and that deserves the administrative reductions. But if you're working independently, we have paperwork and a relationship requirement that would make sure that the patient has a full complement of the best folks taking care of them on a regular basis. That's why we support this bill. That's why we're so happy that we've worked together with PAs on this bill, and that's why we hope this bill is going to pass this session. Secondly, I want to address gun violence. I just returned from the AMA meeting for a week up in Chicago. This was their annual meeting, and of course gun violence was a hot topic up there, not just because of the mass shootings, but because of the number of times that guns are used in violent situations against other individuals and even against self when we're talking about suicide here in the U.S. Our policy at the North Carolina Medical Society has long spoken for more than a decade to gun violence prevention and has put mental health issues first and foremost. We are proud to hear others taking up that same mantra and addressing gun violence, not just by talking about the various types of guns that are out there, but actually talking about the need to address the health concerns that are leading to much of the gun violence in this nation. We appreciate Senator Tillis and the bipartisan support that he's put together to put forward a first step on this with the federal gun safety legislation that is currently being considered by the U.S. Congress. We also appreciate Senator Burr, both of our senators from North Carolina, for signing on and endorsing this legislation. This is a positive first step. It's not the end of the conversation. It's not the solution to everything, but this is a positive first step to addressing what the AMA has labeled as a public health crisis. And we agree that we've got to put heavy work into this going forward. Finally, I want to address House Bill 149. Now, you'll remember this was the telehealth bill last year that the Senate took just a couple of weeks ago and turned it into a Medicaid expansion plus bill. And I've gotten a lot of questions from members over the last few weeks about why can't we just amend House Bill 149? Why can't we support portions of House Bill 149? Or is everything really bad because of this, the way that the Senate put it forward? And so I want to be careful and help you understand all the moving parts of this bill. As Senator Heiss said in the committee meeting where they actually passed this out of Senate Healthcare, this bill includes a lot of other ideas beyond Medicaid expansion that could never move on their own. So the only way that they could move them forward was to bundle them together and hope that we all liked Medicaid expansion enough that we would agree to all these other things. And that's just frankly not the case. In the op-ed that you saw me write this week, we've talked about speaking the plain truth. So let's talk about the truth around this bill. Yes, it expands Medicaid for the working poor, and thankfully we are appreciative to the Senate for addressing this very important issue that we have been asking them to address for more than a decade. But we disagree with the need for these other elements, as they've articulated, to support Medicaid expansion. The first piece of this is the hospital assessment language. Now, this was important language to make sure that we had the 10% matching funds for Medicaid expansion. Unfortunately, the Senate went much further and manipulated the hospital assessment in new and interesting ways to where they provided relief for the insurance companies, the PHPs who are paying a Medicaid tax, in addition to changing the hospital assessment to pay for Medicaid expansion. On the SAVE Act, you've heard us articulate why we are opposed to nurse independent practice. But who else would benefit from this? Insurance companies who would pay less for services rendered to patients instead of doctors. In addition to this, we have a telehealth provision that is saying it's to shore up telehealth, because originally that's what this bill was all about. But instead it puts a provision in there that gives veto authority to health insurers to judge the quality of your care and decide retroactively whether they're going to pay for your telehealth service to your patient or not. On top of all this, there are CON provisions that are more complicated and confusing. Our hospital partners dislike this bill. There are some doctors that do like this portion of the bill. But it doesn't address CON comprehensively. It is one small step, and it's an absolute all or nothing for us to be in support of Medicaid expansion if we were to support the CON provisions in this bill. Finally, there are contracting provisions in there around surprise billing that adjust the current law around notice and provision and caring for patients that are out of network right now that don't favor the patient. They just scare the patient. And there are also contract stipulations about whether you are in a conversation with your insurance company and how long you have to give them notice before they kick you out, as well as how much they are required to be at the table to have a legitimate conversation with you about negotiating rates to make sure that you can provide the best care for your patients to the widest group of patients in your community. So if you go back and you think about all these provisions that are in this bill, who really benefits? Is it hospitals? Is it doctors? Is it patients? Yes is the answer to that in some parts and pieces along the way. But the only group that truly benefits from the entire package of this bill are insurance companies. That's what this bill is for, insurance companies. Not you, not hospitals, not your patients. It's for insurance companies. And that's the fundamental reason why we cannot be for 149. Now, does that mean that we can't be for Medicaid expansion? We can't be for strengthening your practice? We can't be for our patients? Absolutely not. We can be. But it has to be in another vehicle. It can be in the budget. It can be in technical corrections. It can be in a standalone bill, all of which we have availability to in this session. And your North Carolina Medical Society is working hard to find another way to move Medicaid expansion because we know that helps. So what's next for us? We've been put in a serious defensive posture this year, and you have shown up. You've called your legislator. You've met with them in person back home. You've written emails and used our action alerts. You've come to Raleigh and talked with your legislator about the concerns that you have for your practice and for your patients. We have to step that up going forward, but we need to step it up in a way that takes the fight to the legislature, that where we tell them what's best for your practice and what's best for your patients, and we don't let the insurance companies decide what's best for us going forward. That's what we're going to bring to you in the future. That's what you're doing right now, and that's what I want to thank you for the most. Thank you for being engaged. Thank you for being a part of the solution. Thank you for making this personal for you and your patients back home so that legislators understand the impact of the decisions that they're making here in Raleigh. I look forward to bringing you more information as we go into the budget week next week, and hopefully coming to a conclusion with this short session very soon. Thank you, and keep it up.